Okay, we're going to talk a little bit about malaria, Plasmodium. And first thing we have to know is that the first phase is a sexual phase, and the mosquito, the Anopheles mosquito, will inject its sporozytes in, and the sporozytes are injected in to the body, and they get to the liver, where they reach the hepatocytes. And remember, this is asexual. So in this asexual reproduction, we must understand that after a while the cell will burst, the hepatocyte will burst, and merozytes are released. And these merozytes will then go into the red blood cell. This is called the erythrocytic cycle, and into the circulatory system. And we must think about, before it gets to the schizont stage, they are trophozoites, and before the trophozoites they are small rings, and these are the rings that are seen in the red blood cells. And then they grow, and let's take a look and see what happens within the cell cytoplasm. What's happening is that this parasite is eating the cytoplasm, which breaks down the hemoglobin into amino acids, and there is a hemozosin buildup. So let's take a closer look. Hemozoin buildup. So the pathogenesis is like this. What's happening is that the disease causes red blood cell lysis, and hemoglobin metabolism is affected, so that the hemozoin pigment is built up in the red blood cells, and then the hemoglobin is broken down, which leads to anemia. And then what happens is that the red blood cells agglutinate, and so these red blood cells are infected. And as it gets worse, you might see that there is a modification of the erythrocyte membrane, which can lead to CNS complications, such as with Plasmodium falciparum. So let's take a look again. You can see that it starts with the Malaria Plasmodium, and the mosquito then sends in the sporocytes that goes to the liver. This is the asexual stage, and then the hepatocyte bursts, merozytes come and into the red blood cell, and then there's the ring trophozoite, schizont, and looking inside the cell you can see there is a buildup of the hemozoin, and that the cytoplasm is eaten and broken down, and what happens is you end up with anemia because of the breakdown of the hemoglobin, which can cause agglutination of the red blood cells and modification of the erythrocyte membrane, and this you can see in Plasmodium falciparum. So let's try to remember this.